Look, here I want you to remember the emergency, medical emergency term, which is ABCDE approach. This term or this approach can be used for trauma and non-trauma patient if you are thinking of emergency situation or emergency station. Always remember the A is for airway, the B for breathing, the C for circulation, D for disability plus blood sugar, and E for exposure and plus temperature. This is added to for airway. Always consider suctioning and airway maneuvers to open the airway and airway adjunct to maintain the airway. And for obstructed airway, we will learn this in another scenario. For breathing, always inspect the chest and check respiratory rate and trachea position, expansion of the chest, air entry, color, and O2 saturation, SpO2. For circulation, you have to know the pulse, blood pressure, capillary refill, limb temperature, peripheral pulses, urine output, cannula insertion, blood test. This diagram is just to review your knowledge about ABC in general as emergency situation. Disability and the blood sugar, disability is regarded Glasgow Coma score, blood sugar, pupil size, alert to voice. Is the patient alert or response to voice or to pain or unresponsive patient? For exposure, patient need to have adequate exposure and complete examination and always monitor temperature in emergency patients. Now let's take some examples for the ABC approach for the medical emergency. You are a first doctor in general surgical ward, and the nurse asked you to see this is a 65-year-old patient admitted 2 hours with acute cholecystitis. He is being given the antibiotic and now develop a rash, tongue and lip swelling. So we have patient who receive antibiotic. Now he develop rash and tongue and lip swelling. So what is this? This is allergic reaction to drugs. This is anaphylactic shock. This patient has anaphylactic shock. He's still not on oxygen, but does have, he has cannula. Initial assessment for this patient, the respiratory rate was high, 28. The heart rate also was high. As we said, this patient with anaphylactic shock. SpO2 is start to be low. Temperature is within normal. There is erythematous rash, and particularly around the cannula. The observation can look. This observation can be varied from patient to patient and from scenario to scenario. But in this scenario, this is a scenario of a patient who is admitted to your hospital in your care, and he received antibiotic and he developed rash and tongue swelling. So what will be your action? Here we will discuss this. First, you have to follow the ABC of this patient, ABC of medical emergencies. So first, the airway. For this patient, the airway is compromised. As you remember, we said the patient have lip swelling and tongue swelling. This means obstructed airway. So what is to do? The main thing is to open the airway in this patient. The A is the most important thing. You have to follow the A. So the patient have compromised airway. So use airway maneuver and airway adjunct. Airway maneuver, as we said, head tilt, chin lift, jaw thrust, and airway adjunct like nasopharyngeal airway, and put the patient on O2, on oxygen. Breathing, as you know, breathing, the respiratory rate is high and saturation is low. With audible, what to do? Give salbutamol by nebulizer for this patient. And for C, for circulation, the circulation is high. So what to do? You have to disconnect antibiotic. This is very important, and commence fluid resuscitation. You have the patient will, as we said, the patient is in anaphylactic shock, so you have to give fluid resuscitation and stop the antibiotic, and also give hydrocortisone and chlorphenamine, and never ever forget that adrenaline 0.5 ml of 100 to 1000 should be giving IM first. For disability, the patient is alert and very anxious. Blood sugar, you have to send for blood sugar. Exposure to C. erythematous rash only. So to review this, if you don't know anything about your case, or not about your case, about your station, but it is emergency station, follow the ABCDE approach. The A for airway, so the patient airway is good or not. The patient breathing is good or not. In this patient, the breathing was not good, so we give salbutamol. The airway was compromised, so we open the airway and give oxygen. And then circulation and the drugs. In circulation, they mentioned that the patient is hypotensive and the patient has a heart rate increase, so we give fluid resuscitation, we stop the antibiotic, and as our patient, we are thinking about anaphylactic shock, so don't forget to give adrenaline IM and hydrocortisone IV. So let me summarize the treatment for anaphylactic shock. Treatment for anaphylactic shock, treatment of anaphylactic shock, it will be like this. Number one, which is the most important one, is IM adrenaline. Number two, IV fluid. Number three, you have to give O2 for this patient. Number four, IV steroid, hydrocortisone, IV hydrocortisone. Number five, you have to give this patient chlorphenamine, which is, we used it as alermine. We call it alermine sometime, the traditional name. So these are the main treatment for treatment lines for patient with anaphylactic shock. If the patient have airway problem, remember airway is first. Some of them came to hospital, but there is no airway compromisation, so we give just the medication. IM adrenaline dose is 0.5 milligram or 0.5 ml to be giving IM in the anterior lateral part of the thigh, anterolateral thigh, anterolateral part of the thigh. Again, the diagnosis is anaphylactic shock due to antibiotic allergy. This patient needs resuscitation and stabilization. He may need definitive airway management and endotracheal intubation. Investigation to be sent for this patient: full blood count, clotting factors, urea and creatinine, a liver function test, glucose, blood group, ABG, ECG, and chest X-ray, which are all these are the main investigation for the emergency conditions. Again, in the management, as we mentioned, the steps of management in the first lecture, as you know, we said it consists of treatment and the procedures and location, which is where to do it, and monitoring of the patient, and the specialists if needed or not. Let me say, in cases of anaphylactic shock, we need anesthetic and senior medical help, senior medicine. Monitoring, the patient need regular observation. Location, the patient respond quickly on the ward, but a critical care setting if not. I mean by this, I remember a patient who she was 42 years old, a lady presented with anaphylactic shock, and she was struggling in anaphylactic shock, not quickly respond to drugs. So after she start to respond to drugs, we transfer the patient from emergency department to the critical care department, and after 2 days we discharged the patient. So that's the idea. Some of patients need a critical care setting. Procedures that we will do it in anaphylactic shock, we have to put IV access, and we may need an endotracheal intubation for those patients. Again, the drugs that we give adrenaline, we give steroid, we give nebulizer, we give antihistamine, alarmine or chlorphenamine, and IV fluid, and remember oxygen, airway secure, and stop antibiotic. This is the main drugs that we are giving in this condition. After that, you have to document clearly the allergy of the antibiotic that happened for this patient. This is the last thing to do it for this patient on the drugs chart, and discontinue the current antibiotic prescription. This is very important, not in the emergency station. After you finish the station, the examiner will ask you what else is to put a note on the patient file that this patient has allergy. This patient have allergy from this antibiotic.